Welcome to this HOBIC video tutorial. In this video, we will provide a quick overview of the changes made to the Therapeutic Self-Care Scale. This tutorial will begin by providing you some background on the Therapeutic Self-Care Scale and why refinement was necessary. Next, we will look at the three main categories of change. First, we will examine how the TSC questions have been divided into two separate assessments, one asked at admission and the other asked on discharge. Second, we will examine the improved coding scale provided with this new version of the TSC. And finally, we will provide you with an overview of how we reduced the number of questions in the scale from 12 to 8. Let's begin with a quick review of the definition of self-care. Self-care refers to the patient's ability to initiate and perform activities that are aimed at maintaining health, managing health problems, and restoring functioning. The Therapeutic Self-Care Assessment itself is designed to assess patients' ability to take care of themselves once discharged home. The assessment focuses on four main areas: the patient's ability to reliably take medications, the ability to recognize and manage symptoms related to any or all of their health problems, their ability to perform activities of daily living, and their ability to manage changes to their health. Refinements to version 1 of the Therapeutic Self-Care Scale were initiated in response to feedback from those using the scale in participating acute care facilities. Researchers who examined the TSC measures also expressed interest in seeing the scale changed. The goal of the refinement process was to make the questions easier to understand and relevant to patients both on admission and discharge. In addition, the allowed response options are much more precise, thus reducing some of the confusion patients experienced when trying to score the questions on a scale of 1 to 5. The final recommendations which led to these changes were based on a two-phased revision study completed in 2009, titled Refinement of the TSC Scale, by Soraya Sadani, Diane Doran, Patty Tracy, and Malini Prasad. Now let's examine how the Therapeutic Self-Care Scale has been divided into two separate assessments. The original TSC scale required that users ask the same question both on admission and discharge. While the number of questions and topics discussed remain the same, the wording of the questions have been reworked to make them easier to use and administer. The TSC admission assessment focuses on patients' self-care ability prior to their hospitalization. The discharge version focuses on the patient's knowledge and ability to care for themselves once discharged home. The TSC admission assessment should be administered within 24 hours of entry into the hospital and is important for understanding the self-care abilities of the patient prior to their hospitalization. The TSC discharge should be administered on or around the patient's day of discharge. It is meant to gauge the patient's readiness to care for themselves once released from hospital. The second major change to the Therapeutic Self-Care Scale was made to the coding options. The previous 1 to 5 scale asked patients to rank their knowledge and/or capability on a continuum where 1 was equivalent to not at all and 5 was equivalent to very much so. This is now all changed, and the scale is much more descriptive than the previous version. Patients are now given the option to rate their knowledge and/or capability as either not at all, somewhat, or very much so. In addition, two additional coding options, unable to assess and not applicable, are now available if the circumstances warrant their use. In addition to the coding options, the information source codes have been updated to include another field. This other field allows for the free text entry of information into the assessment. The patient or nurse can now choose the source of the information as being from the patient, family, both, or another source. And finally, we are on to the third and final major change to the Therapeutic Self-Care Scale. The number of questions in the scale has been reduced from the original 12 down to 8. While none of the new questions are exact replicas of the original set, many are simply reworded versions of the existing questions. As previously described in this video, one question will be asked on admission and a slightly different version asked on a discharge. Question 1 asks, "Do you know what medications you were taking at home before you came to the hospital?" While the question 1 discharge asks, Do you know what medications you have to take when you go home? Question 2 on admission asks, do you know why you were taking your medications? Question 2 on discharge asks, do you know why you are taking your medications? Question 3 on admission asks, do you take your medications, pills, drops, or creams, as ordered by your doctor? Question 3 on discharge asks, are you able to take your medications, pills, drops, or creams, as ordered by your doctor? Question 4 on admission asks, were you able to notice symptoms or changes in your body related to your health? Examples of this include pain, fatigue, or dizziness. Question 4 on discharge asks, are you able to notice symptoms or changes in your body related to your health? Question 5 on admission asks, were you able to carry out treatments to manage your symptoms? Question 5 on discharge asks, are you able to carry out treatments to manage your symptoms? Examples of these include massaging of painful areas, working at a slower pace if tired, or breathing exercises to treat shortness of breath. Question 6 on admission asks, were you able to do your everyday things like bathing, shopping, and preparing meals? Question 6 on discharge asks, are you able to do your everyday things like bathing, shopping, and preparing meals? Question 7 on admission asks, do you have someone to call if you need help to do everyday things like bathing, shopping, or preparing meals? Question 7 on discharge asks, do you have someone to call if you need help to do everyday things like bathing, shopping, preparing meals? And finally, question 8 on admission asks, did you know who to call in case of medical emergency? And question 8 on discharge asks, do you know who to call in case of medical emergency? We would like to thank you for taking the time to review this video. If you have further questions or educational needs, please visit our website at community.hobicoutcomes.ca